Cynophobia, also known as the fear of dogs, is a type of specific phobia that involves an excessive and irrational fear or anxiety in response to dogs. This condition can significantly impact an individual's daily life, causing distress and avoidance behaviors. In this episode, we will explore the nature of cynophobia, including its causes, symptoms, effects, and potential treatments. Like other specific phobias, cynophobia can arise from various factors. It can be caused by a traumatic experience involving a dog, such as being bitten, chased, or attacked by a dog in the past. These experiences can create a lasting impression and trigger a fear response toward dogs. Additionally, negative or fearful experiences with dogs in early childhood, such as witnessing a dog attack or being raised in an environment where dogs were perceived as dangerous, can also contribute to the development of cynophobia. In some cases, the fear of dogs may be learned through social conditioning. For example, if a person grows up in a household where their family members or caregivers display fear or anxiety towards dogs, they may develop similar feelings towards dogs through observational learning. Cultural or societal factors can also play a role in the development of cynophobia, as certain cultural beliefs or childhood teachings about dogs can shape an individual's perception and fear of the animals. Furthermore, genetic and biological factors may be involved in the development of cynophobia. Some research suggests that individuals with a genetic predisposition to anxiety or phobias may be more susceptible to developing cynophobia. Imbalance in brain chemicals such as serotonin and dopamine, which play a role in regulating emotions and anxiety, may also contribute to the development of phobias, including cynophobia. Cynophobia can manifest in a variety of physical, emotional, and behavioral symptoms. The severity of symptoms can vary from mild to severe, depending on the individual and the specific situation. Intense fear or anxiety in the presence of dogs or even the thought of encountering dogs. Rapid heartbeat, sweating, trembling, shortness of breath, or other physical symptoms of anxiety. Avoidance behaviors such as avoiding places where dogs are present or altering daily routines to avoid dogs. Difficulty concentrating, feeling on edge, or being overly vigilant for signs of dogs. Panic attacks or feelings of impending doom in the presence of dogs. Interference with daily activities, relationships, work, or social functioning due to the fear of dogs. Excessive worry or preoccupation with dogs even when they are not present. Hypervigilance or heightened sensitivity to dog-related stimuli such as barking or growling. Another interesting fact is that cynophobia is not limited to all dogs, but can be specific to certain breeds, sizes, or even individual dogs. For example, some people may be afraid of large dogs, while others may have a fear of small dogs. This highlights the unique and individual nature of phobias, as they can manifest in various ways and have different triggers for different individuals. Cynophobia can have a significant impact on an individual's quality of life. The fear of dogs can interfere with daily activities, relationships, work, and social functioning. Individuals with cynophobia may avoid places where dogs are present, such as parks, neighborhoods, or public places, which can limit their ability to engage in normal activities and enjoy outdoor spaces. The fear of dogs can also disrupt relationships with friends, family members, or neighbors who own dogs or enjoy being around them. In some cases, cynophobia can lead to isolation, social withdrawal, and a reduced quality of life. Furthermore, the fear of dogs can cause emotional distress and psychological discomfort. Individuals with cynophobia may experience ongoing anxiety, fear, or panic attacks in the presence of dogs, which can be emotionally taxing. The constant worry and hypervigilance about encountering dogs can also lead to increased stress and anxiety, which can impact overall mental well-being. Fortunately, there are effective treatments available for cynophobia. It is important to note that seeking professional help from a qualified mental health professional, such as a psychologist or psychiatrist, is recommended for accurate diagnosis and treatment planning. Cognitive behavioral therapy, or CBT, is a widely used and effective approach in treating phobias, including cynophobia. It involves identifying and challenging negative thought patterns and beliefs related to dogs, and gradually exposing oneself to feared situations in a controlled and supportive environment. This can help individuals restructure their thoughts and develop coping strategies to manage their fear. Exposure therapy can be done in various ways, such as imaginal exposure, or imagining encountering a dog, virtual reality exposure, using virtual reality technology to simulate dog encounters, or in vivo exposure, directly facing dogs in real-life situations. In some cases, medication may be prescribed to individuals with cynophobia, and particularly if the fear is severe and significantly impacts their daily life. Anti-anxiety medications or selective serotonin reuptake inhibitors, or SSRIs, which are commonly used to treat anxiety disorders, may be prescribed to help manage the symptoms of cynophobia. Supportive therapy, such as counseling or psychotherapy, can also be beneficial for individuals with cynophobia. It provides a safe space for individuals to express their fears, concerns, and emotions related to dogs and can offer support, validation, and guidance in managing their phobia. In addition to professional treatment, self-help strategies can also be useful in managing cynophobia. These may include educating oneself about dogs, learning about dogs' behavior and body language, gradually exposing oneself to dogs in a controlled and supportive manner, and practicing relaxation techniques or mindfulness to manage anxiety symptoms. Phobias are real psychological conditions that cause distress and impairment and should not be dismissed. Please subscribe and share so that we can help spread the awareness. If you or someone you know is struggling with anxiety or a phobia, seek help from a qualified mental health professional for evaluation, diagnosis, and treatment.